I've been coming to India for quite a few years as a jewelry designer. I produce my product and send it back to America. When COVID hit, I was stuck here and had COVID and pneumonia and recovered beautifully, and had problems with my back. So I sought out help from the hospital, the college, I think the medical college, and they referred me to a few people. I went to see all of them, and finally met with this wonderful, wonderful Dr. Kataria, and this wonderful, wonderful hospital. I don't know why any Indian doesn't come here besides going to a private hospital. So I came. It took some time to get all the tests. They ran so many tests. It was so perfect. I mean, if there's anything missing and you don't know about me, I'll be very surprised. So I came here and was just amazed at the facilities, at the care, at the doctors, the assistants, everything. Everything was just beautiful. So, I mean, do you have any questions? The only thing I can complain about, because it is a problem in India, is that they need to have management who does nothing but cleans the toilets. And they do it maybe 3 or 4 times a day so that people don't slip, that the light's on, and it smells peaceful when you go in there. And that's really it. But I've been attended to. Dr. Kataria did the most magnificent surgery, and his assistants, how many people, and the anesthesiologist, I don't know names of everyone, but they were great. I woke up, I wasn't sick, I was nauseous for this much. The next day I was awake, wanting to get up, and he was like, no, you sit down. And 2 days, I guess, I was up, ready to walk. And this is my 4th day. He wants to keep me here, and I'm like, I'm ready to go home. But I feel great. And people say, you're American, why are you coming? This is by far superb and just wonderful. My ex-husband is a doctor, and he looked up Dr. Kataria and said, you have great hands, and do it, go for it, and everything's been very supportive. Dr. Kataria, do you want to ask me?
You had severe pain while you came here, and after the surgery you are doing perfectly okay?
I have no pain. He won't let me dance, but I have no pain now. So, and they gave me Indian blood. So I woke up, and the first thing I wanted was roti and dal. So I don't know. So now I'm half Indian. Do I get to stay here? Any questions? He's been wonderful. He pushed to get me in here, and it was a struggle, but they did it. So thank you so much, Dr. Ankit, Dr. Sachin, and nurse, everybody. It was just, I just have a smile on my face all the time. I've told all my Indian friends, what are you doing going to these private hospitals? You get the attention here. They're not concerned about how much they're making. I went to see one doctor, and I said, how much do you think this will cost? And he was like, like maybe 5 lakhs. I'm very expensive. Look at my suits. And I thought, doctors just don't talk like that. But I don't know. I wish Americans could figure out a way to come here and get surgery for many things.
Thank you. Okay.
Hey, Dr. Kataria, I'm so sorry I didn't say that I was in pain for almost 2 years before this surgery, and every doctor I saw would just put me on pain medicine and a few other things that they thought may have worked. And one of the brilliant things that you have is you can read x-rays. I think there were doctors who looked at the x-rays and couldn't see that the L5 and L4 needed some help and needed the plugs or whatever you call them. So I'm really sorry that I didn't say that. And so when I came to you immediately, you looked at the x-rays, you knew what the problem was, and I asked you, if your wife had this problem, what would you do? And you said, I would do surgery. And I listened to you, and I'm very thankful for that. I'm sorry I didn't say that, but if you'd like for me to add that, I'll be happy to.